Aidian-Grey here. The last video my phone did go dead, and so I had to charge it. So let me go over very quickly high blood pressure patients and coronavirus. Coronavirus attaches to the ACE2 inhibitor, and this is metadata. I'm not doing research myself on coronavirus, and I'm not doing research on high blood pressure. So what I'm sharing with you is things that I've gotten from the literature and things that I've heard from other experts on YouTube, just like you. All of them seem to be mystified as to why high blood pressure patients are being affected by coronavirus. So let me share with you my thoughts on that. Coronavirus attaches to the ACE2 receptor on your cell. And so if you're taking, and there has to be research of this, the high blood pressure patients who die, are they on high blood pressure medicine or are they not? If they are, if it is the case that, as I've heard, that ACE2 patients are dying for coronavirus, that is because ACE2 or coronavirus attaches to the ACE2 receptor. And so if you're on an ACE2 inhibitor, that brings down your ACE2, and then the coronavirus brings it down even further. What happens when you get really low ACE2 is that it affects your lower lungs, not just your lower lungs, but your lower lungs, your heart, and your kidneys. So you need to raise that ACE2 up, but you have to talk to your doctor, because if you're blood pressure medicine, there's a reason why he gave you an ACE2 inhibitor. So it doesn't make much sense to me, but because low ACE2 causes all these medical problems, including heart problems. But you have to consult with your doctor about what you should do. What I would do is if I were a blood pressure medicine patient, is I would try to get off of ACE2 inhibitors, but you can't just stop your medication, especially if you've been on it for years. You have to consult with your doctor. And we need to do data to find out if these are patients that do not have ACE2 or patients that do have ACE2 inhibitors. But if you have a high blood pressure patient and they are not on ACE2 inhibitors, and you give them ACE2 inhibitors because, we got to help these blood pressure patients. And if it is the case that ACE2 inhibitors and coronavirus as a combination in a comorbid condition is deadly, then please do not be adding ACE2 inhibitors wildly just because you heard that high blood pressure patients die from coronavirus, and then the doctor's like, oh, maybe it's because they need to be on medication. Find out, quit guessing, do what you have to do to understand this virus. It's really kind of interesting that this ACE2, this coronavirus epidemic has taught me some things about viruses. And there's some things that I've known about viruses that I really didn't share with anyone. One is they always deplete something. For instance, Ebola depletes vitamin C. So when you see a patient bleeding out with this horrible virus of Ebola, it's not really the Ebola that's making them bleed out. It's the low vitamin C. And although giving them vitamin C may not cure or save them